everyone, this is Marie-Chantal from the Hearing Crew, clinical audiologist with 10 years experience in the field. So I have a really common question from most patients, and that is, why does my hearing aid whistle? So there are a couple of things that you need to look at. Number one, do you have wax blocking the little end piece of the hearing aid, the mold or the dome? So the little hole which is called the sound bore, you need to just double check that. If it's blocked with wax, your hearing aid will most likely whistle. Secondly, you need to check whether you've got a wax blockage in your actual ear canal. That's hard to check yourself, of course, so best that you see an audiologist or a doctor to have a look in your ear. Thirdly, if you actually cover the microphone of your hearing aid, so I do this because hearing aids, the larger part that goes behind your ear, the microphone is here. So if you actually cover that, that will most likely squeal at you, depending on the level of amplification that you have in your hearing aid. Sometimes your hearing aid has a very good feedback management feature built in, which means that it's just a feature that cuts out the squealing before it sets in. Otherwise, if you have a hearing aid that goes right inside the ear canal, there's no back piece, in other words, so ITCs, CICs, IICs, that is not going to affect it, but you can still get feedback if you cover your ears like this, or if there is wax blocking your ear canal, what we call that wax occlusion. Another thing to look at is if you actually walk past a wall or or if you lean your head, if you fall asleep on the couch, and that also blocks the pathway to the microphone, that will also cause a squeal. Sometimes if you hug someone really closely and your heads are touching, that will also cause feedback. If it's a really windy day, the wind will blow over the microphone, causing whistling from your hearing aid. So that's a really common thing, unless you have a hearing aid with high level technology built in that has a wind management feature, which means that when you get a gust of wind, it actually softens that experience for you, and you don't get that whistling from your hearing aid. So what else can I tell you with feedback? Essentially, the last thing is actually how your audiologist has set your hearing device. So if you have an audiologist that has boosted a lot of high frequency amplification or high frequency gain in your hearing aid, which means that perhaps you have a sloping hearing loss, that's the most common type of hearing loss that we see, in which case we will most likely boost the gain or the amplification in the higher tone spectrum so that you can hear accurately. The double-edged sword there is sometimes if you match it to what you require in the really high frequencies, depending on the level of technology in your hearing aid, it is more at risk of getting feedback. So that's something else that we will need to look at in your appointment. If all of those previous things have been ticked off and they're not of concern, the last step is to look at the amplification settings in your hearing aid in the high frequency range. So typically we just edge that down, not to the point where you won't be able to hear properly anymore, of course, but certainly just keeping that edge a bit down, and that will typically cut out the feedback. So if you have a mold or a dome, it really needs to have a good seal in your ear canal. If you don't have a good seal, then you'll get some feedback. So that's something that you need to see an audiologist in person about, to just ensure that the seal is perfect. The other thing is insertion technique. You need to practice getting the hearing aid in your ear properly, again, to create a perfect seal for you. So you've got a couple of steps there, or actually a lot of steps to have a look at, a lot of variables that influence the risk of feedback, and Otherwise, if you're still at a loss and you're not really sure what to do, it's really best to check into your audiologist in person and have a chat as to what they could possibly do for you. If you have any questions at all, please feel free to drop me a line, and I'll endeavour to get back to you within 48 hours. So my email address is below. Alternatively, you can have a look at our website, www.thehearingcrew.com, and one of our specialists will be in contact with you if you would like to see us for an appointment or have a 15-minute phone call with us. Okay, thanks for listening.